Donc sans transition, Jean-Christophe Billou, responsable de la Fédération
And
nationale
now,
des MARPA,
Jean-Christophe Billou, head of the ARPA National Federation, who is about to present these testing workshops. Greetings everyone. I will first present you ARPA, even though Madame Depessé did it before. It is a small organization, a little life unit with less than 25 residents, which is friendly and familial size. So, this is not a big organization, and of course these nursing homes are dedicated to fragile persons. They are on the same hand independent and in decrease of independence. There is no discriminations within this mission. And we mainly care about helping these fragile persons. There's also another principle that we are focused on. This is the freedom of residents to choose their own healthcare professionals, but also to benefit from the services of the organization. There's also a project of life, which brings closer accommodation and reception in ARPA to a personalized home life, as much as the quality provided to families and residents, which is an important point for us, since ARPA are legal organizations. They are evaluated by 15-year cycles and accredited establishments, which brings more guarantees to residents.
Autre principe important, un accompagnement global est proposé aux résidents, à la fois un accompagnement qui est personnalisé bien sûr, un accompagnement personnalisé du point de vue physique, mais aussi...
Another important point is global support to residents through a personalized support as much as mental and physical, with many workshops and actions in order to maintain their independence as long as possible.
Alors quelques chiffres.
Here's a few figures. 25 years of existence. The concept dates back to 1987 and was built in 1990. As said Madame de Beauvais, there are 167 establishments, 1,500 residents and 1,000 qualified professionals. I should indicate that the training of our staff is also an important point for the National Federation and the managing team. And here's also a few figures to inform you that life units are between home and health establishments. ARPA are not health establishments, and we will see this later with the workshop presented. The average age of the residents is 84, which is the average in other establishments. The average duration is 3 years in the residence. So, here's a photo picturing the lifestyle in ARPA. And then let us pass on to nutrition topic. ARPA concept is characterized of several points. The quality, but more specifically the meal quality, because they are all prepared in the establishments. This is an essential part of the concept without any meal delivery. There is also a specific architectural design with the possibility in each room and for each resident to have a kitchen where he can cook himself. But he can also share his meal with other residents in a dining room which is not called a restaurant. This is optional for residents. We have also planned not to isolate the kitchen in the building in order, when standards allow it, to have an open kitchen attached to the dining room and so to the residents. We have also planned a area between these two rooms where residents can help with the tasks. It can be peeling to cooking a meal. Of course, there is a certain degree of involvement and participation differing by establishments. There is also a meal commission implemented which highlights us on the fact that the residents have the control of what they are eating and an influence on the food that is served. Nonetheless, they can participate in cooking meals, but also can suggest meals through these 2 points, the commission and the suggestions. Feeding plans are also implemented with a dietitian.
Par le biais de ces deux possibilités, la commission et le cahier de suggestion. Alors, il y a aussi, dans certains établissements,
It was said before, there are no food deliveries. It is forbidden in ARPAs.
Je le disais tout à l'heure, il n'y a pas de portage de repas, c'est interdit dans les établissements MARPA.
There is also another dimension. It is the involvement of supportive relatives to the team for the meals. This is an important dimension because it adds friendliness. There are, in consequence, special rates for them. Traditional cooking is also part of the ARPA, obviously in agreement with the region. The last two speakers talked about it. There is also a vegetable garden. It is often the work of one resident who organizes the garden. We have also planned a best practice guide, which includes a feeding topic with medical advices about co-dental hygiene and various preventions. And finally, the training of the staff, a subject which is required, especially from the ACCP standards associated from the kitchen design and preparation of meals.
L'initiative de ce partenariat entre la Fondation Louis Bonduelle et la Fédération nationale des MARPA revient.
So the initiative of the partnership between the Louis Bonduelle Foundation and the ARPA National Federation goes back to the Louis Bonduelle Foundation, which contacted us and has grown a lot, as I said before, to the residents, of course. We have listed the different reasons of why we have come closer in expertise on the feeding questions, of course. I told you that the ARPA concept dates back to 1986. We have had some perspective regarding the preparation and cooking of meals, retirement houses, a shared diagnosis of aging well. An important point because we, ARPA, are sensibilizing and defending the independence of the residents, even though it is residual. Also, this is a responsibility. We are 162 establishments, a public figure with an obligation of subscribing the Louis Bonduelle Foundation, an obligation field work and communication, especially with preventive actions, as I said before, but bucco-dental hygiene and aging well workshops offered by the Social Agricultural Insurance, which the National Federation is close to. Regarding workshops, as said Madame de Possé, participants and 40 resident staff, an average of 102 professionals were involved to support the residents, the Louis Bonduelle Foundation, the ARPA Foundation, the Social Agricultural Insurance. Because we have local referents in each of their office, there is a referent which follows the ARPA, and so some of them have been involved in these workshops. Finally, the local politicians who also participated.
Les problématiques qui se sont posées
So, issues that occurred to us before the animations were many.
plurales, nous ne souhaitions pas que ces ateliers soient infantilisants, mais au contraire plutôt valorisants.
We didn't want it to have condescending workshops, but only opposite gratifying workshops. As an example, we consider vegetable and fruit sculpture condescending, which wasn't the case.
Alors, les ateliers aussi qui devaient être adaptés à un public
The workshops had to be adapted to elder people having various pathology, or at least discomforts regarding vision and smell. Madame Sulmon said before, but also manipulation, which could cause problems for the second workshop, which included food manipulation.
Mais des ateliers également adaptés aux ressources limitées des MARPA, des établissements.
But also workshops adapted to the limited resources of the ARPA, responsible and co-responsible.
Pour ces ateliers ont été réutilisés.
All the used materials have been used again. There was also collective workshops respecting the free will of the residents, because we respect the freedom principle in the choice of life of the
Et
residents.
enfin, des ateliers qui créent la surprise, mais sans pour autant bousculer, excusez-moi. Bousculer parce qu'évidemment... ces
And
ateliers
finally,
étaient
astonishing
aussi
workshops. They could be a source of stress, but
parce que
we did not
un
wish
peu
for.
intrusif, les ateliers, évidemment,
Because it was a little bit intrusive, but they weren't compulsory but optional.
Et ça, je trouve que les animateurs de ces ateliers ont respecté justement les résidents qui ont souhaité participer.
The animators have respected the residents who wished to participate by explaining priorly the approach.
Qui a été mené par Marc Pouillet, un artiste de jardin.
The first workshop is Art Nature, which was managed by Marc Couillet, garden artist, with a setup of vegetables and other vegetals to create what we can consider as art pieces. And finally, using vegetable and the available space to create ephemeris pieces. These creations are ephemeris, and a lot of managers and residents wanted to preserve them, so thanks to table sets, it has been the case. The added value of the project is made of 3 points. No strength or knowledge required in order to participate. These workshops have been done as a community and with limited finances. Here's a photo of the animation of these workshops. You can see that the participation was good with a perspective work. And what is interesting is that many residents have created several pieces, which underlines their motivation.
Alors, les résultats de cet atelier, pour les ateliers, s'agissant de l'atelier Art Nature, les résidents ont été un peu impressionnés.
The residents were a bit surprised by the artist's qualification, who had bought his portfolio. They were slightly intimidated, at least at the one that I attended to.
L'atelier auquel j'ai participé. Mais ils se sont quand même lancés de manière tout à fait décomplexée.
They proceeded with no complexes, and we had a creative result, which was very interesting.
Ce qui est intéressant aussi, c'est que les résidents avaient souvent une idée de création bien précise. C'est intéressant.
And what is interesting is that residents had often a precise idea of creation in mind. There has also been a person with a specific handicap, but that wasn't an issue to incorporate this kind of poorly communicating person having problems expressing himself. I can remember a person who had problems expressing himself because he had lived in Spain, but it hadn't stopped him of being happy and motivated. Valorization, which we'll talk about later. Creations have been carried out, and it is of course a recognition of the residents because they have appreciated to work not should I say of their roommates, but residents. Obviously, a playful dimension is important. We have concluded that this workshop has brought happiness, but also creativity, which was much more present. And there has been many creations: Christmas trees, rosettes, Lorraine crosses.
Donc une grande variété dans les créations. Et puis évidemment la dimension partage est très importante puisque c'était un moment essentiellement de convivialité.
That is to say, various creations. Obviously, sharing is very important because it was a friendly moment through shared creation and fun.
Toutes les œuvres ont été présentées d'ailleurs. Les résidents ont présenté chacun à leur tour aux autres résidents et aux
All the pieces have been presented to other residents and participants.
Voilà, alors l'atelier cuisine et sens.
And now, the Cooking and Senses workshop is made of two parts: a blind tasting phase and the creation and testing of canapés.
Ce qui est aussi important, de chaussons salés et sucrés. Donc voilà, reconnaissance et identification gustative.
The blind tasting is really interesting because even with the loss of vision, there has been good results and a good identification of the flavors of cheeses and yogurts.
Des parfums aussi qui ont été présentés à travers des fromages, identification de fromage, identification de saveurs de yaourt également.
The objective was indeed sensitive recognition, and this was also a success because the smell and touch stimulation was well conducted.
De l'odorat et du toucher à travers justement la manipulation de la pâte pour la constitution des chaussons s'est faite de manière tout à fait convenable. Cognitif aussi parce que
it was also cognitive because there was work on memory of certain dishes with participants remembering dishes they hadn't cooked or tasted in a while.
Et puis enfin, la manipulation des aliments, évidemment, un aspect très important, mais il n'y a pas eu de problème particulier de ce côté-là. S'agissant de la valeur ajoutée, évidemment.
And finally, the food handling, but there hasn't been any major problems in this side. Regarding the added value, obviously, there has been a good apprehension because it was carried out before snack time. We are intending to copy this workshop with Madame de Souillet, maybe not in all the 162 residences, but at least in half of them.
Et comme je le disais aussi tout à l'heure, peu de ressources existantes et réutilisation de tous les matériaux.
1 to 2 agents were sufficient regarding management. There was few resources used and materials were recycled in order to cook
Une
again.
valorisation évidemment des résidents, le plaisir et le bien-être.
So, if we draw a global summary, there has been a valorization of the residents, the pleasure and welfare, much more in the canapé workshop than Art Nature workshop as being more creative. Global stimulation is also a positive
Même
point.
pour ceux qui n'ont pas participé, même pour les résidents qui n'ont pas participé, ils ont été quand même associés, et ça c'est toute la vertu des.
And finally, even for those who haven't participated, they have been associated with the project, even though they didn't, thanks to the qualities of the animators and the conversations.
Le bilan, évidemment, découvrir.
The conclusion: residents and members have discovered themselves as much as we did.
En passant. Et donc, il y a aussi, on a bousculé aussi certains a priori, puisque les ateliers.
We have also shaked up given ideas because the workshops seem not really that original, but on the same hand there has been astonishing associations of sweet and sour. For example, there has been a chocolate and sausage pie. We have faced astonishing mixes, but on the same hand, this is also creativity.
Surtout d'ailleurs, je dois dire, Aurillac sur Vandinelle, et la volonté des responsables, évidemment, de
The participants have been satisfied, and it has been a huge success in the free ARPA, especially in the Bonduelle residence. And the will of the organizers to reproduce these workshops for the residents. Because of the success, there will be an educational toolkit in order to communicate it all to the ARPA this month. We also are planning to get involved other generations with children in schools. This is often the case. There has also been a share of experience in local and national communication operations. We are also planning to do it in an ARPA close to Paris, in order to bring the medias and other actors of the socio-medical field in order to spread those workshops. And of course, the benefits for the National Federation is the registration of the offers of workshops offered from the ARPA to the residents. The concrete reaffirmation of the ARPA concept, notably through the health sensitization and the preservation of the residents' independence through workshops which served as tools. And finally, the ARPA gathering around a common animation and workshop projects. I would like to thank the Louis Bonduelle Foundation, Betsmith Media, which is here today. Julie Copé, Marc Bouillet, the Art Nature artist, and finally the managers of ARPA and our residents. Thanks for your attention. Thanks a lot, Christophe Billou, for this very interesting presentation. Just a little question, even though we are late. Regarding your workshops, there has been a reluctance of certain residents who were integrated to the group. Has there been a lot of resistance among them? No, not at all. There has been a massive participation. Almost all the residents have been attending, and those who didn't were involved, talking with other residents. So it was an important success.
Y étaient associés, donc venez participer, discuter avec ceux qui participaient justement à la création des objets ou la constitution des chaussons aux pommes. Donc ça a été vraiment un succès important. Quand on dit une quarantaine de résidents,
40 and 70 residents participated. This is a good figure.
C'est quand même pas mal.
Okay, long live to the workshops. And now it's going to spread all over France. Thanks a lot.